Welcome. You're tuned to the Urban Affairs program. It's time to get up for Urban Perspectives with your host, Pete Rhodes.
Welcome. You're watching Urban Perspectives. I'm your host, Pete Rhodes. This edition is sponsored in part by Comcast Internet Essentials, the Council on Black Minnesotans, and BMAnetworks.com. On this episode, we continue our series recognizing outstanding contributions by women in art, business, education, and health. Thank you for joining us as we salute women in our communities here on Urban Perspectives. My first guest goals are to positively impact the health and living conditions of those experiencing health disparities. Her specialties are trauma and critical care, emergency medicine, and cardiovascular ICU. She is the president of the Minnesota Black Nurses Association. Please welcome to Urban Perspectives, Shirlynn LaChapelle. Shirlynn, how you doing?
Good, Pete. Thank you so much.
You know, we go back a little ways, back to Riverview.
Yes, about 31 years.
Yeah, it's a little while there. You look fantastic, and you're doing a fantastic job in our community. So let's just get right to it. What inspired you, one, to become a nurse, and what are your goals as the president of the Minnesota Black Nurses Association?
My mother in Chicago inspired me. She was an LPN, and then my father dying of cancer when I was 15 let me know that I wanted to alleviate pain and suffering and death.
So there now, as president of the Black Nurses Association, what's your goals there?
My goals are to mentor, to help alleviate the health disparities in our community, and not just within the community here, but we have a global perspective because we are citizens of the world.
Exactly.
And part of the National Black Nurses agenda is to help improve the outcomes of health, to educate the public on how to be good partners in their health care, how to understand what it takes to be a healthy individual and to work toward those goals while at the same time affecting change, because policy change is what's needed in order to improve the health of everyone. We need insurance, we need access to health care, we need healthy foods, affordable healthy foods. We have to have a place to live that is affordable, clean, free of rodents and things like that. We have to have a good education so that our children have a chance at a good life.
A healthy life.
A healthy life. And we are mind, body, and spirit.
So you talked about the association's mission. What is your relationship with the community organizations? I see you work around a lot with individuals we talked about them earlier, and how do they help further your mission as the president of this organization?
Well, you can't do anything without a collaborative model. Otherwise, you're siloed, and we know silos don't work. So I have to say Lutheran Social Services has been an excellent partner. Southside Community Health Clinic, University Health Disparities Program and Health Disparities Research, Minnesota Department of Health. We do things with UCARE and the Humane Project and other organizations. And because we work in concert, and Health Fair 11, because we work in concert with these various groups, we're able to do more. It enables us to have a far-reaching advantage over just being alone.
By yourself, yeah.
Yes.
So important. Explain to the audience how the Minnesota Black Nurses Association enhances recruitment for future nurses and opportunities.
Oh, wow. Okay, this is my big chance. We have a spring gala every year, and the purpose of that gala is to raise funds so we can give away scholarships to student nurses.
I see, I see.
And the future of nursing, according to the Robert Wood Johnson Institute, is about furthering the education that nurses going into advanced practice all the way to the doctorate level. So the Minnesota Black Nurses Association sees its role as a partner, but we are actually working harder to get the entry level in, as well as to help them go further in their education. So we mentor high school students and nursing students who come out with us on our events so they can learn what it means to work in the community and to impact the people in our community, how to communicate so that the people understand that they have a partner. We're here to help you, but we're here to listen.
So volunteers are important. We know
absolutely.
that. Are there any programs that your organization does annually? You talked about the annual dinner. Are there other pieces that you could point out that would get individuals to be able to come out and support you?
Well, we participate with other groups. We have a diabetic foot clinic that we do monthly at Lutheran Social Services Center for Changing Lives during their food shelf, and it's free. And we do blood pressure and glucose screenings, and we wash feet like Jesus, and examine the feet, and we give away a free pair of socks.
Yeah.
And along with that comes education on diet and how to prevent diabetes or how to manage your diabetes. Because many people end up getting amputations because they don't understand that a scratch or bruise or what have you on the foot or the toe could end up turning into gangrene.
In the small time that we have left, Shirlynn, what has being involved like this done for you?
Well, as I move further along the age spectrum, it has given me a whole new role. I've moved from critical care to public health, and instead of impacting one person at a time, I can impact the world. Because public health is a global thing. It's looking at things that benefit everyone. And so I seek at this point in the juncture to empower other nurses and young people in particular, that nursing is a wide-ranging profession and it can do great things for many people.
Well, you have certainly made me feel comfortable right here today. Shirlynn LaChapelle, thank you so much,
Well,
hometown.
Thank you.
Thanks for coming, and we'll talk to you soon.
All right, thank you.
Weekly here on Urban Perspectives, we present Shining Stars highlighting people, places, and events that contribute to the vibrancy of the urban community. Our Shining Star this week is a 5-time Minnesota Music Award recipient for Best Spoken Word Artist. Her collaborations with major hip-hop artists locally and nationally has earned her respect in a male-dominated industry. Meet our Shining Star, Desdamona.
Hi, my name is Desdamona, and I'm a spoken word and hip-hop artist. Music in general has been a part of my life in some way or another. I grew up dancing a lot, and my mother really loved music, and we would be cleaning and dancing on the weekends. It just definitely does something for me emotionally and even spiritually on some level. And so being able to create it, then that's just even amplified even more. Well, the first time I ever wrote a song, I was about 15, but it wasn't until later, until I was in college, that I really started to take it more seriously, and that was around the time when the first Fugees album came out, Blunted on Reality. So Lauryn Hill had been such an influence to me, just hearing her on the record, and it really pushed me and inspired me to write a lot. I think that being a creative person makes you realize your power, and I want that for everybody, for everyone to realize that they have power, because then I think the world changes once we all realize that we have that. I hope to just encourage and inspire young women to keep pushing, and that all of the things that we come up against, you know, there is still sexism, but I feel like all of these things that we come up against really just make us stronger and more powerful, and it gives us more to say, and all of our struggles can lead to something great. It will be so mega, but the alpha will be back again. The horsemen will be marching in, witnessing the reckoning, repenting for all the sin. Let the sirens sing again. If I bring the mothership, the people will be packing in. Red alert, siren sound, what's really going down? Thieves in the temple, storm tonight. Everybody run for your life. I'm Desdamona, and you're watching Urban Perspectives.
Thank you so much, Desdamona. Coming up next, I talk with the Executive Director of the Leukemia and Lymphoma Society of Greater Minneapolis and St. Paul. Meet Teri here on Urban Perspectives. Welcome back to Urban Perspectives. Our next guest oversees the Minnesota chapter of the world's largest voluntary health agency dedicated to finding a cure for blood cancers. She is the director of the Leukemia and Lymphoma Society of the Greater Minneapolis and St. Paul area. Please welcome to Urban Perspectives, Teri. How you doing, Teri?
Hi, Pete. I'm good.
Good. Glad to have you here. I was wondering, with all the great things that you guys are doing here in the Twin Cities, do you ever get a chance to rest? There's so many things that your organization does.
We do. We have a lot of activities. At the chapter level, we are fundraisers, but we also support a lot of programs for patients. We encourage anyone with blood cancers to call our organization.
Well, what are the diseases that are considered blood cancers, and how are they detected, Teri?
Sure. The Leukemia and Lymphoma Society supports patients who have more than 150 types of blood cancer. So it's everything in the categories of leukemia and lymphoma, but also myeloma, myelodysplastic syndromes, and myeloproliferative neoplasms. And blood cancers are diseases of the bone marrow, the blood cells, the lymph nodes, and the lymphatic system. And in fact, every 3 minutes in the United States, someone is diagnosed with a blood cancer, which means that in the Minnesota chapter's tri-state area of Minnesota, North Dakota, and South Dakota, in the next year, more than 3,000 people will be diagnosed with a blood disease.
Wow, that's interesting. How do you help to support that research? It seems like enormous research in blood cancers needed to be supported. You do that with events, and what else?
Right, so we fundraise at the chapter level and we accept donations, and in the past 65 years since LLS was founded, we have invested more than $1 billion in blood cancer research. And we do that in a continuum from everything from basic research to clinical trials, or as some people would say, from bench to bedside. So we are working in many new targeted therapies and immunotherapies, and our funding also is supporting the training of the next generation of cancer researchers.
I see. Now, what kind of survival rates are there? I had a young friend in 7th grade that passed away. What kind of survival rates are there for patients with detected blood cancers, and what is the most effective treatment?
Well, the good news is that it's improving. Back in the 1960s, when LLS first started, the survival rates were pretty low, and since that time they have either doubled, tripled, or even quadrupled, depending the type of blood cancer someone has. As an example, in myeloma back in the 60s, the 5-year survival rate was 12%, and today it's 47%. Fantastic. And in the most common diagnosed pediatric blood cancer, leukemia, which is probably what your friend had, the survival rates back in the 60s were only 3%, and today it's approximately 90%. So we are finding some really amazing advancements in some of the types of blood cancer, but not all of them. So,
what are some of those treatments, you know, that individuals would undertake, and do they improve the quality of life for those survivors?
Sure. Well, the good news is in cancer research, a lot of the new therapies that are coming out are oral medications, so of course that helps, and the delivery of the medications has improved over the years, so people now have ports to receive their chemotherapies and their medications, which is of course helping that quality of life during the treatment, and we are investigating, we have projects that are just looking at the quality of life to make sure that people, once they're done with the treatment, that the after effects are not detrimental. But we have many types of treatments.
Yeah, that's great. You know, we attended an event last year that was fantastic. I think it was the Man of the Year event. You do host annually programs. Is that coming up, and how does that help to bring awareness to the organization?
Sure. Well, you speak about awareness, and one of the things about blood cancer is there's no way to detect it early or to change your lifestyle so that you can not get blood cancer like some people can. Some organizations have the opportunity to spend their money on education and awareness to tell people to, you know, stop doing this lifestyle and you will not get cancer. We don't have that opportunity. By the time someone is diagnosed with blood cancer, they're in full-blown disease. So the way that we spread awareness is by coming on programs like this and through our fundraising events. We have our Man and Woman of the Year fundraising campaign that you came to last year. It kicks off April 1st. We have a big climb event coming up on April 18th, and that's where people will climb, and it's chip timed. They'll climb the Capella Tower stairs, either 48 or 95 flights. One of our signature events is our Light the Night Walk. It's an evening walk where people carry lanterns with a white lantern if they're a patient, a red lantern if they are supporter, a caregiver, and a gold lantern in memory of a loved one lost to cancer. And then, of course, we have team in training. You can train to run a marathon, Pete, or ride a 100-mile bike ride.
You're talking to me now.
Yeah, I'm talking to you. You can come out and do that with us.
Sure,
so we have
sure.
many, many fundraisers.
Well, Teri, you do a fantastic job, a lot of work there, and I know you don't do it alone. You got a lot of great volunteers. We encourage individuals to step up to the plate and then do some of these things that will help in the long run with the organization. Keep up the great work.
Thank you, Pete.
Teri Cannon, thank you. Coming up next, we talk with a licensed insurance professional in the healthcare industry. Hear how her expertise helps to educate the underinsured on the best options for healthcare. It's all happening here on Urban Perspectives. Welcome back. My next guest has over 18 years of experience in the healthcare industry. Her goals are to generate interest and educate prospects about insurance products and their options. She is currently an exchange and individual insurance representative for UCARE, the fourth largest healthcare provider in Minnesota. Please welcome to Urban Perspectives, Carla Foster. How you doing, Carla?
I'm good.
Good. I was just saying, you know, we've done this a number of times over the years, and appreciate having you here with us today.
I'm glad to be here. Thank you for having me.
You know, our parents have been enrolled with UCARE for quite a while now, and can you explain to the audience how it helps with their health coverage insurance?
Sure. Well, Pete, your parents probably have our UCARE for Seniors program, which is for people with Medicare.
Yeah.
Original Medicare only covers about 50% of your overall health care. So a person can either choose to pay that other 50% out of pocket, or they can pick up a Medicare Advantage plan like UCARE for Seniors, or a supplement to help fill in the gaps of Medicare. Unlike a supplement, our Medicare Advantage plan allows the member, where a supplement pays second to Medicare, our plan allows the member to coordinate their Medicare Part A hospital benefits along with their Medicare Part B medical, and they can include the Part D prescription drug coverage. And then we also have other options to choose from, like dental coverage, or if they work out at a facility, they could get a gym discount or something like that. So we have other options available as well.
Good program for them. They love it a lot. Most young people feel, by the way, that they don't need health insurance. Why is this such a myth?
You know, Pete, I don't really think that is a myth. I think that young people think they're young, they're healthy, they don't ever go to the doctor, they don't need insurance. But if something catastrophic happens and they end up in the hospital, they could end up with a huge emergency bill or hospital bill. This is especially true for young parents. Children get sick, accidents happen, so I don't think that's really a myth.
Yeah,
I think that's true.
I guess it's important to take a look at. Now, does Minnesota rank high nationally in health insurance coverage, and if so, why?
Yes, it does. First, we have some of the lowest rates in the nation. We have very generous Medicaid eligibility and Minnesota Care, which is a program for people on or low-income working folks. We have generous standards that has allowed us to maintain a low uninsured rate for years. There's studies out there that show our rate prior to our uninsured rate prior to the ACA open enrollment period, it was at 8.2%. That dropped after the open enrollment down to 4.9. So there's other studies that show we're ranked 7 in the nation. That's a pretty good ranking, I think.
Very good. Now, what products does UCARE offer as part of the Affordable Health Care Act? I know you're partnering with MNBNA in certain ways, and what do you do?
We have 2 products that we offer, and they're only sold through MNBNA, the healthcare exchange here in Minnesota. UCARE Choices and another product called Fairview UCARE Choices. Each option has different plans. They're rated differently based on where you live, if you're a smoker or not, and your age. You can't be rated on your health anymore. So that's a really big thing for a lot of folks.
So those two plans are can be administered and are administered through the UCARE itself.
Yep.
Yeah, great. Now, what does UCARE do to promote awareness and educate the uninsured about its products? How do you do that?
Well, Pete, UCARE is really about educating and giving back to the community. So we have, we offer Medicare enrollment or product meetings, as well as basic Medicare one-on-one meetings, so to help the member understand how Medicare works. We also allow folks to come into our office anytime, Monday through Friday, during business hours. They don't need an appointment. They can learn about any of our programs that way as well. And then they can also visit our website at ucare.org, www.ucare.org, and find out more information, as well as get information on where the meetings are.
Now, you've been doing this for a while. What is the one important thing in the small time that we have left that you have learned about the importance of education for health?
I think it's important for a person to know all of their options, and that's what we really stress at UCARE. We want the member to do what's best for them and their family, regardless if they choose UCARE or not, even if it means going to a different health plan. We're all about the member and putting the member first.
Yeah. Well, great work, and always a pleasure seeing you again. And
thank you.
Do a great job over there, and tell everyone we say hello.
Thanks, Pete.
All right, Carla Foster. Thank you for watching Urban Perspectives. I would like to thank my sponsors, Comcast Internet Essentials, the Council on Black Minnesotans, and BMAnetworks.com, my guests, and you, the audience, for getting up with Urban Perspectives. Visit our website at urbanperspectives.tv for information on our guests and where you can find links to previous broadcasts. Help us grow. Like our Facebook page. And remember, there are positive things happening in our cities. You can see them right here on Urban Perspectives. Now enjoy the photos of the week featuring the Greater Twin Cities United Way Centennial Celebration. I'm Pete Rhodes, and I'll see you next week.